All right, this is our product testimony disclaimer. We're not here to diagnose any medical problems. However, this site is for informational or educational purposes only and does not substitute professional medical services or consultations with a healthcare professional. And that being said, we're going to go ahead and get started, and we want to welcome everybody to the call. Oh, this is great. This is great, guys. Y'all have done well tonight. We're up to 40 people. Awesome, awesome. That is so great. But we just like to welcome everyone tonight on our Tuesday night Zoom call, our health and wellness call. We're excited for each and every one of you. So if you're new on the call, please just put in the chat section that you're new. This is your first time, and who invited you on the call. You can say new, Uncle Mike, new Sharon, or whoever invited you. But we certainly welcome each and every one of you here tonight. And we're grateful for all of our leaders that are on the call. And at this time, we're going to do our company motto. Chris, we are ready now. Thank you. All right, Uncle Mike.
All right. Thank you very much, Sales Master Sharon Wilson. Want to say good evening to everyone. Want to welcome everyone to our Tuesday night, 8:00 p.m. Eastern Standard Time call. And we're going to have a great time. I'm first going to demonstrate how we do our company motto. Okay, so I'll say company motto. Are you ready? You'll raise your fist and say yes. I'll say go. We'll say cherish the spirit, arm extended, create the vision, follow the faith, arm extended, serve in humility, aja, aja, aja. Okay? All right, everybody unmute your phone. All 42 of us, unmute your phones. Unmute your phones. All right, with that being said, I just have one question. Company motto, are you ready?
Yes.
Go.
Cherish the
All right, thank you very much. Once we want to welcome everyone to the call. I'm going to ask everybody to put yourself on mute, or Sharon, mute out everyone and let me come back in.
Okay.
Yeah, we'll mute everybody out. All right, thank you very much. Once again, we want to welcome everybody to the call. At this time, I'm going to turn it over to Sales Master Sharon Wilson. Sharon, take it away.
All right, thank you so much. We're grateful for all of our leaders on the call, and we just like for them just to address you for about 30 seconds. And we're going to start with, let's see, Miss Patricia Hornsby. Unmute, or can you unmute? Okay. Okay, try it now. Go ahead. There you go.
Good evening, everyone. My name is Patricia Hornsby, Sales Master from NC Global, and I'd like to welcome you to our Tuesday night Zoom wellness call. And I'm excited because we have a lot to say, a lot to offer. So ladies and gentlemen, hold on to your hats, hold on to your seats, but take your pen and take notes, because we are going to be sharing some marvelous, super fantastic information for you this evening. So welcome again. Thank you so much. Back to you, Sales Master Sharon.
Thank you, Miss Patricia. All right, we're going all the way. Well, we'll stay in the Carolinas. Mon and Ari, just go ahead and greet us. Sharon Rose Master.
Hello, everyone. This is Mon Akabong, Sharon Rose Master of NC Global. Welcome, everybody. Take notes. We got some great information for you guys. I know my friend is here. Pantalek is here. We want to know more about how he can take care of his diabetes. All right. Thank you, everybody. Thank you, Sharon.
Awesome. Thank you, Mon. Let's see, Mr. Thomas Jacob. I know you're reclining and recuperating. Can you just holler at us for a second?
Hello, Sharon.
Hello.
Good evening, everyone. Hope everybody's feeling well. I'm on injury reserve right now. I can't come on. I'm in doctor supervision. I had a major injury about a month ago, but I still love Atomy. Atomy loves me. If it had not been for Atomy, when I had my injury, I don't know what would have happened. The nutrition that was in my body kept me from hitting the sidewalk. So I just say thank you for being here tonight. Take good notes. We don't know what tomorrow is going to bring. but just being around these powerful speakers, these powerful testimonies could change your life and your family's life. Back to you, Sales Master Sharon Wilson.
Thank you, thank you, thank you. Miss Sherry Lee, holler at us for a second. We're super excited. So Sherry is probably at work. We have some more leaders on the line, and we definitely want to recognize Sharon Rosemaster Maritas from North Carolina. Say something to us.
Hi, thanks for waiting. Thanks for inviting me, Linda Milroy. I'm a sales master from NC, and glad to be here. And thank you.
All right, glad to have you. Awesome, awesome. Any more Sharon Rosemasters? Miss Sue, she's having her little sip of coffee. Just greet us real quick, please, ma'am.
I'm delighted to be here, and I really appreciate the fact that you all present some really, really informative information for all of us to share. So I really, really appreciate this call, and I really love everybody that's on the call, and good luck to you, Mr. Jacobs. Hope things go well.
Awesome. Thank you so much. Thank you so much. Any more leaders on the call? Just quick, give us a 30-minute hello, or we don't want to miss anybody because we know that you worked hard to get where you're at. So we want to recognize you. Anyone else? All right. Well, we'll hear from our superstars towards the end, but thank you all for joining us tonight. And we see that we got a lot of guests on. Thank you. Thank you. So we're not going to belabor the time. I'm just super excited to be a part of Atomy. Been with the company 2 years. Listen, I just left Atlanta, guys. We got to go to the seminars there. I just left Atlanta, just got back home about 30 minutes ago, actually, and I saw the hotel that we're going to be at. It is fabulous, okay? Fabulous. And I know that with our leaders all that's going to be there, it's going to be a lot of information. So we want you all to come and go with us to Atlanta, and hope to see you all there. So at this time, I'm going to turn it over to Uncle Mike, and he's going to give an introduction to our superstar guest tonight. We're super excited. I heard her a couple of months ago, and I'm telling you, she was just absolutely amazing. Her testimony, and I hope she shares how she became a part of Atomy as well as she does her presentation. But Uncle Mike, take it away, sir.
All right. Thank you very much, Sales Master Sharon. Listen, you all give yourselves a hand. We're at 55 people tonight. I sent a message out earlier today. I said, let's hit 50. And I'm telling you, everybody stepped up to the plate. That's what makes it happen when we all do our part. It helps us. There's been so much excitement. I've been on the phone just about all day since early this morning. I am just so happy. I just love this company. And ladies and gentlemen, our speaker for tonight, I am so happy. I am so proud to be able to introduce to some and present to others this beautiful lady, Dr. Suzanna Dotson. She has been married for 30 years. She has 2 beautiful children, a daughter 24, a son 17. She is board certified family physician. She is also licensed, listen, hold on. She's also licensed in 6 states, okay? And she practiced hospital medicine, and she have a private practice in Pembroke Pine, Florida. So ladies and gentlemen, without any further ado, let's give a warm welcome to Dr. Suzanne Dotson. Dr. Dotson, how are you doing?
I'm doing well. Thank you, Uncle Mike. Thank you for that lovely introduction. I'm just going to give the caveat that you said I've been married 30 years. I'm going to say I was a child bride because I'm only acknowledging to be 39. So, but thank you for that lovely introduction. I'm very excited to be giving this talk. You guys will be hearing it for the very first time. I thought I was going to give a small, intimate group a talk, and now I'm a little nervous seeing how many people are here, but I'm glad to, because like you, I love Atomy. I love his products. I feel, I feel a particular honor and to be able to share this information, and from my position as a physician to be able to explain and go expounds on this topic of diabetes, which plagues so many of us and those we know. So if I can begin, I'm going to see if I can share my screen. Let's see. I hope this works. Okay. All right, there we go. So again, this evening, I want to talk a little bit about diabetes mellitus type 2. This is a very common medical condition. Because of the audience, I wanted to tailor my discussion to how it relates to Atomy and how Atomy's products can help. Let's see, okay. All right. So type 2 diabetes is the most common form of diabetes. There are lots of different forms: gestational diabetes, diabetes insipidus, etc. Tonight, we're going to focus on type 2, which is commonly known as adult onset diabetes. This is the one type that, it's preventable and certainly modifiable. So what is diabetes? I don't want to go too deep in the roots, but I just generally, it's an intricate interactions involving your brain, your liver, your pancreas, your intestines. And basically, the long story made short, it's a condition where your body does not produce, regulate, and or use insulin properly. So leading to high blood sugar levels, right? Glucose is another medical term for sugar. So high blood glucose levels causes short and long-term damage. So you want to, I want to focus on prevention, because Atomy is all about, health and wellness and prevention. So what we can do to avoid getting type 2 diabetes, or if we have it, how we can manage it well, and maybe even, there's not a word cure, but you can control it, right? So, one of the ways you do that is by eating a healthy diet, right? Lots of vegetables, grains, and fruits. You want to avoid things like fried and high fat foods. You want to avoid processed foods and cheeses and whole milk. The second thing for prevention is weight control, right? So if you have a BMI of 25 or less, that's the goal. So 25, between 18 to 25 is considered normal. So if you're above that, your goal is to make your way towards 25 or less. I don't want people to get discouraged, because even like 5 to 7% weight loss can prevent or delay onset of diabetes. So that means, if you're, 200 pounds, 10 pound loss will significantly impact whether you can prevent or delay the onset or further progression, right? We want you to do regular exercise, right? The goal is 30 minutes of physical activity, 5 days a week. But you need to start slow, and don't, Rome wasn't built in a day. So you're not going to, work your way up to 30 minutes for 5 days a week the very first time you're out. You start slow and build up endurance so that you avoid injury, and that you can, it's a practice. So you have to incorporate it into your daily routine. It can't be something that you just do for a short period of time to lose the weight and then go back to your old habits. It needs to be part of your regular daily routine. The other thing I would say is you need to be tested. So if you're one of those people who don't like to go to the doctor, the idea is to just at least go once a year and keep yourself healthy and maintain, so that you only need to go for your annual screening and check. But 1 in 3 Americans have pre-diabetes, right? That's the stage before you get to frank full onset diabetes. So if you don't know if you don't get checked, very often pre-diabetes, you're not going to be symptomatic. So a lot of the symptoms that come with diabetes later, after a lot of the damage has already been done, you're not going to feel. So you need to get checked, okay? The other thing is drink water, drink lots of water. I know lots of people think, oh, I drink water a lot, but you really need to measure. Unless you're drinking like 2 to 3 liters of water a day, you're not drinking a lot of water. Yeah, some people nurse 1 bottle of water all day and thinking because you're near water, you're drinking it. That's insufficient. And my recommendation is to avoid soft drinks, avoid sodas. It's just full of non-nutritional sugar. High fructose corn syrup is not your friend. They put it in everything, even bread. So you have to watch your labels. And, you know, for the people who tell me, oh, doc, I don't drink sodas, I just drink juice. Listen, unless you are freshly squeezing the juice yourself, it's junk. It's full of sugar. It's full of high fructose corn syrup or some other sweeteners. And it's not the healthiest for you. They use that term juice very loosely. Okay. Again, so I'm back to how can Atomy help? So before we get to be very specific, here are some parameters for how we diagnose diabetes. Your normal A1C is 5.7. Really, it's 5.6 or less, right? So, and then the pre-diabetes range is from 5.7 to 5.6. Once you hit 5.7 and 6.4. Once you hit 6.5 or higher, you are considered frankly diabetic. There is a way back to normal range, and hopefully, we'll all get there. So the first product that Atomy has that I really recommend is psyllium husk. And I'll go into details later about what psyllium husk does and how it works. But basically it is fiber. And fiber lowers your blood glucose levels, and that's how it impacts your diabetes. I'm sorry, this is what I was afraid of. Okay, here we go. So I brought this to show you a real life case of one of my patients. So this is a new patient who came to me, as you can see, in April. We checked her hemoglobin A1C. She was 6.0. This was her first diagnosis of prediabetes. She, of course, she was upset. She's like, Doc, I don't want to take medicines. What can I do? Right? So sorry. Okay. So she came back to me. I set up an appointment for her, and she came back to me. We did a whole discussion, and I recommended the psyllium husk. So you can see here that we rechecked her test, her hemoglobin A1C in July, and it was down to normal, 5.5. But that's not the most significant part of this. In addition, I added this because in addition to lowering your blood sugar and helping your diabetes, it also helps lower your cholesterol. So this is another really great product that you want to be taking. Psyllium husk is not new, it's nothing special that Atomy has invented, but they have formulated, I would say, a high quality and a good balance of the soluble and insoluble fiber. Let me see. Go down here. So you can see in April, her triglycerides and her LDL, which is considered your bad cholesterol, was elevated. The non-HDL cholesterol was 130, you can see. And now she comes back in July and it's lowered. Look at her triglycerides, normal. Her LDL is 92, goal under 100. She's met it. The non-HDL is down this 116. But I showed this screen because I want you to see that she really came back to me for the weight management on June 22nd. You see that where the red is circled? So literally, she started on the psyllium husk June 22nd, and then we repeated her labs July 11, July 12. So it's in 3 weeks, you got that dramatic impact, where her A1C went from 6.0 to 5.5. Those of you who have diabetes out there, you know how difficult it is to get movement, but to get a 0.5 movement in 3 weeks, it's phenomenal. And it really just speaks to the fact that, number one, she was compliant, right? That means she took the medications as I prescribed it. And it also speaks to the efficacy of it. Because I've been telling patients to take, Metamucil is another brand of psyllium husk, but I don't get the same impact because, number one, people are non-compliant because they don't take it. It doesn't taste good. The Atomy psyllium husk, it tastes like grape blueberry juice. Like, how can you, so those of you who like juice, how can you complain about drinking a glass of juice once a day or twice a day, depending on what I prescribe, right? So I wanted to share that real world kind of testimony from one of my patients so you could see it's not just me saying it, but these are objective findings, and that you can't control your blood test results. So this is the constellation of products that I recommend specifically if you have type 2 diabetes, and I'll go into each one, why I chose each one. Okay, so again, I start with psyllium husk. Fiber binds exogenous cholesterol. Exogenous, medical term for cholesterol you put into your body, meaning it's the stuff you eat, right? So it binds it and you excrete it out. So that's why it works so effectively, right? So, and again, as I said before, it contains soluble and insoluble fiber. So the combination has to be right. If you have too much of one and not the other, then you'll end up getting gas and bloating. And again, people won't continue to take it because you have other side effects or symptoms. You really won't have that with this one. And also, I also make sure I don't ask my patients to take things that I myself wouldn't take, or that I haven't asked my family members where appropriate to take, right? So I take the psyllium husk and I love it. And I use it more for weight control. And that's another topic of discussion, which we can do on another day. Fiber helps, with what we call glycemic control, right? Basically controlling your blood sugar. That's how it works. I recommend 10 milligrams daily, and this isn't just something I picked out of thin air. There are studies that were done with, psyllium husk in 10 milligrams. The study was done with 7 milligram in the morning, 3 in the evening, but it doesn't really matter. The Atomy packets are 5 grams, 5 grams in each packet. So if you can take both at once, or you can take 2 packets, at two separate intervals. Okay. Also, I recommend, taking it separate and apart from your other medications, right? Because it has to do with absorption. The next product is Atomy probiotics. It's all the rage now, right? Because all the studies have come out talking about, the microbiome, the importance of your gut health. Right, so you've got trillions of bacteria, viruses, and fungi that live in your intestinal tract. They're supposed to, and it does. The important thing is you want to have a healthy balance of good bacteria over the bad bacteria. You usually have, GI problems when you have an imbalance. And an overgrowth of the bad bacteria, bad viruses, and bad fungi that's in your gut microbiome. Okay, so the Atomy probiotics is kind of it's foundational, right? Your gut, your intestine is a super important part of your immune health, right? It's next to your skin. Your gut is kind of like first line. So it's also very important, and everybody's working every day to try to eat right, take their medications. None of that matters if your gut is not healthy and balanced, because that's where all the absorption happens. That's where all of the nutrients are absorbed and taken into your body. So if it's not healthy, you're probably wasting a lot of the products that you're eating and taking. It's just kind of going right straight through because it's not being absorbed. Okay, let's see. This is one of my favorites because everybody likes to use this for dieting and weight loss, but it's also very good for diabetes and glycemic control, right? So Atomy Pure Tea, it contains a compound or component called gallic acid, right? So gallic acid is something, it's a phenolic compound, which, it's been shown to have antioxidant, anti-inflammatory, and anti-neoplastic properties. I don't want to scare you with all these words, but I also use the technical terms because I want you to be informed. I want you to go and read up and look things up on your own. There's no magic or secrets in medicine anymore. I mean, the information that's available to me is available to you if you choose to seek it. So that's why I make sure that I use the appropriate terms, but we'll break it down. Antioxidant just means that, it prevents cell damage that's caused by oxidation. So, right, that's why foods like blueberries that are high in antioxidants, it's good for you because you want to prevent cell damage. It's anti-inflammatory, all right? It prevents or reduces inflammation. A lot of the absorption problems that people have in the gut stems from inflammation. If your gut lining is inflamed, it is not operating optimally. It's not
Pasok bukas.
so
Oy, bis.
the next term is it's anti-neoplastic, right? So it's a medical term for it's anti-cancer, right? So it has all of these properties. I added to my collection here is because I think the diabetes component, it works really well. It reduces hyperglycemia, right? Medical term for high blood sugar. So it's going to reduce your blood sugar. It reduces insulin resistance so that your body can use the insulin that you make well, and it reduces inflammation. All of the things that are kind of hallmarks of diabetes, right? And why it causes the problems it does. Sorry. So the other thing is there are NIH studies, so you can go to something called PubMed, right? So lots of medical studies are available to the public. So there's an NIH study, right, that shows that gallic acid ameliorates hyperglycemia, right, through a complex, hepatic mechanism. Basically, in translation, it says, it reduces blood sugar by working on your liver to make it stop producing extra sugar. Okay, let's see. So the other supplement that I really recommend is the Atomy rhodiola milk thistle. It supports liver health. It plays a big role in your overall metabolism, and your liver, right, acts as your body's main filtration system. So everything you ingest, you drink, you eat, all of that, it gets first passed through your liver. It's broken down into components that your body can use. Specifically to diabetes, it prevents, that's where gluconeogenesis takes place, fancy word for sugar molecules being made by your liver. Diabetes medications work on the liver to reduce that. So having a very healthy liver is very important for all of those processes that, all of the metabolic processes, all the medicines that you put in, even the supplements that you take, right? It gets broken down and filtered through your liver. So having good liver health is important. I love telling this story about milk thistle and I had a patient who, was an alcoholic. told me, you know, I really can't stop drinking for whatever reasons. Liver was failing. I asked him, I actually gave him the milk thistle, and I said, please just take it as I prescribe. And oh no, my battery's dying. Please take it as I prescribe, and it will help you. And if it doesn't work, you don't have to pay me. If it works, then next month you'll pay for this box and get more. Lo and behold, 3 months later, we completely normalize his liver function, right? And I kind of feel bad a little bit because I feel like I've given him carte blanche to drink more, but at least I know his liver is safe. The other way that we know what's special about Atomy rhodiola milk thistle is the quality, right? He lives in North Carolina and half the time here. He ran out, bought some at a store in North Carolina, took it for the 3 months, came back, we retested, liver enzymes shot back up. So quality functional foods and supplements that you take make a difference, right? So, okay. I'm afraid I'm gonna lose my battery. All right, the other thing is hemohim, right? It's very important. Hemohim is foundational to your overall immune health. And hemohim does, all of the things that your body needs, right? It basically gives you the building blocks to defend yourself. Right? It increases your CD4 count. It increases your CD8 count. It increases your natural killer cells. Those are all important components in your immune defenses, right? Those are key words. So I just want you to know that it's foundational, but it's important that you consult with your doctor before you take it. Not because none of these things are safe or there's some problem with it, but we also need to get your baseline labs. We need to see where you are before you initiate on this plan. And then so we can gauge how you have improved with objective markers. Yes, I know you'll feel better, but as scientists, we need objective findings, right? So the blood tests you can't make up, right? When your A1C goes from diabetes to normal, you can't make that up, right? So it's really important. I recommend that you start one thing at a time because it's hard for you to see the effects of something if you're starting everything all at once, right? Also, I recommend that you get a complete metabolic panel and a complete blood count with differential. If you're one of those people who don't like to go to the doctor and you just want to go to the lab and order your own. But those are the two main things that you need prior to initiating some of these so that you can see your progress. Obviously, if you're trying to treat cholesterol, you're monitoring, you want to do a fasting lipid panel or fasting cholesterol panel. If you're checking your diabetes status, you need to check your hemoglobin A1C. Okay, let's see. I put this, I'm trying to finish up so that I can address any questions if people have any. But also, I wanted to make sure that we bring this up about the company doesn't want you to make outlandish, false, exaggerated claims because you don't need to. These things, people are buying these things. There's a whole GNC and Whole Foods and all this stuff because people are buying it because they know they need these things. Their doctors are telling them, or they just know that it's deficient in their life. So they're buying it. We want to provide quality products that we know are safe and that also can have, extended benefits, right? So if you want to do Atomy for, to earn commissions, you're helping yourself, but you're also buying it from a company that has done the legwork for you in terms of procuring and curating products that are safe, that are high quality, that are affordable, right? And they've done the legwork for you. Okay, I can go on and on and on, but I'll open it up. I'll give it back to Uncle Mike and I can entertain some questions if time permitting.
Okay, thank you very much, Dr. Dotson. Let's give her a hand, everyone. That was outstanding. Some good, simple, down-to-earth explanation. I mean, just an outstanding job. We have been informed and educated tonight. Okay, what we're going to do, we're not going to waste any time. We're going to go right into the Q&A. If you have a question, raise your hand and tell us your name. We'll start with Chris. Yes, Chris. Can't hear you, Chris. Okay, we'll go to Sandra. Sandra, unmute and ask your question.
Dr. Dotson, if you're a type 1 diabetic,
Ask a complete question.
Sandra, I didn't hear. If you're a type 1 diabetic, what happened? What's the question?
can you still take these, I don't remember what it is. I take the probiotics, you know that, but I don't remember the other one you referred to for type 2 diabetics.
Yes,
Yeah.
none of these are prohibited or for type 1. I just focused on type 2 because that is the most common. So that's why, but you all of these as a type 1, you'll just need to tightly monitor your glucose, right? With the continuous, with the CGM, right? But none of these are prohibited and it's all good.
All right, and you talked about monitoring your numbers. So if my current A1C, because I have to have that checked every 3 months, is at 6 point, if my current A1C is 6.2, is it still okay to take it?
Absolutely, because your goal is to get to normal. And your current A1C is where you are probably because you are on some type of anti-hyperglycemic medication. So I would think the goal would be that you want to manage it without having to take either insulin or metformin or glyburide, whatever hyperglycemic you are on. You can either reduce that dose or try to come off of it. So, but yeah, the goal is to reach normal. I understand that 6.2 is considered, well controlled, but for diabetes, but your goal would be to be normal without medications or without pharmacologic medications.
Oh, just one final question, Suzanna. Can you text me, later
Were you able
tonight?
to hear me?
Can you hear me?
Yes, we can hear you.
All right, Suzanna, can you text me the one I should order, please?
Dr. Suzanna, can you hear us?
Oh, wow. Was I muted the whole time? I'm sorry. Were you able to hear me?
Yeah,
No.
Yeah, her question was, she wanted you to text her on those products.
To text it to her?
Yeah, do you know her personally?
Yes, I do.
Okay, yeah.
I'll talk to you offline, Sandra.
That's what I said.
Okay.
All right. Okay, all right. Next, we're going to go to John Mickner. John, unmute.
Okay, the question is this: as far as the efficacy of the products, in other words, if you open up the product, you start taking some, you put it on a shelf, you don't touch it again for several months, is it going to be just as effective as it was when it was first opened? It's a quality control type question.
So I think it depends on what product, which supplement that you're talking about, and it all has it comes with guidance and recommendations on when it's best used by. So I would follow that. but I also saw your question in the written section about, you know, how are we guaranteeing efficacy, right? So that was my question too in the beginning. And I have come to, I've come to this conclusion, my trust in Atomy products versus something else, because when you're buying products, right, you're taking a gamble. You're buying it and hoping that it works or it doesn't, or it does what it says. Mine has come from using it, number one, for myself and see the efficacy on its own. And then also I see the difference that it makes on my patients. And again, I use very objective findings. The other thing is, in terms of quality, it kind of goes down to the company, right? Atomy is here for the long haul, right? So they're not trying to be here and make, you know, quick money on certain products for a short duration of time. They're in it for the long haul to earn your trust. So it is in their kind of corporate culture and ethos to bring forth highest quality products, but also to their, you know, Atomy doesn't manufacture anything. It's procuring the GSGS, right? Global sourcing, global sales, right? So they're procuring the best product from the best place, I guess, to put it, you know, easily, is right. So I trust that they're doing their due diligence, right? Some of the things I definitely, when I recommend it to my patients, I do research. I go to you know, the NIH. I go to and read the studies to make sure that as a physician, as a scientist, I have to be able to back up what I'm saying, right? Okay. But for you all, when you're recommending it to your patients, I would not make medical claims. Because usually, you know, that just sets yourself up, especially skeptics. They always come with reasons why it won't work for them, right? Just tell the story about how it worked for you, how it worked for someone that you know. Okay,
that's great. Thank you.
All right, thank you very much, John. We're next going to go to Sales Master Melinda Rodriguez. Melinda.
Hey, everyone. My name is Melinda Rodriguez, and I have a question about the milk thistle. I have someone that has liver problems, but whenever that person finish a box, I know it's 2 a day. Does he keep on taking more boxes, or when does he stop taking, you know, like the treatment? Okay.
So, right, we're not supposed to be treating anything, but I mean, I can recommend, because I'm a physician and I can say that I want you to take this. The 2 tablets, it's kind of maintenance dose, right? So if someone has, you know, liver disease, and there's a whole broad range of liver disease, because, you know, what causes it, right, makes a difference on how we're going to treat it, right? Because you always treat the etiology. But so to answer your question on that, yes, you'll need to continue after you finish 1 box, because it's very unlikely you're going to fix a liver condition with 1 box of Atomy milk thistle. Number 1, right? The 2 tablets a day it's recommended for maintenance for healthy people. So if you've got liver disease, depending on what, you know, where your numbers are, I'm going to recommend that you take 3 or 4, right? It just depends, because there's the dosage is on the back of the box. So I'm going to make recommendations on how many tablets, but generally speaking, what's on the box is maintenance dose, meaning it's for people who are already healthy, who are trying to stay healthy, not that we're trying to correct something.
Thank you.
All right, thank you very much. Next, we're going to go to Young Brenton.
Hi, good evening, everyone, and thank you, Dr. Dotson. And my name is Young Brenton, Diamond Master from Miami Vice Center. It's not a question. I just wanted to tell you something. I used to be Dr. Dotson's patient. 1 year, like before, I had a 243 cholesterol. I had a high blood pressure. Highest one was 194 to like 168. Actually, I used to take it like a high cholesterol and also high blood pressure medication for 5 years. Somehow, I don't know, I could not control. And more so my, what you may call the sugar level was about 6.4, sometimes 6.2. It was like, she said, like a borderline. I did, you know, I told her my last test was September 2017. Then I didn't go to her 1 full year to 2018. I went and I take a test. I only took it. I told her I'm quitting my medication and I'm gonna try this Atomy product. And she was very skeptical about it. She was so afraid of, I mean, oh my God, Lonnie, please. She really concerned and she was worried. I say, Dr. Dotson, I have to experiment myself. I did. 1 full year, I take a risk. I only take Him, 1 in the morning, 1 in the evening, probiotic, omega-3, 2 times a day. That's it. 1 full year, I completely stopped. 1 year later, my sugar, this was, I still have a record with her because she did it, everything. 5.8.
7.
And I don't, yes. Then everything under 190. And also, I don't take it anymore, cholesterol pill or high blood pressure pill, period. So consistency and your diet, that's what I did. And I am so grateful to Dr. Dotson. If anything, I always ask her and I trusted her because she doesn't go for anything. She only really did what the Atomy because she joined it and she tried first before she even tell anyone. That's why I love her. And thank you very much.
You're welcome. Love you.
All right. Thank you very much, young Brenton. Next, we're going to go to Christopher Griffin. Chris, unmute.
Good evening again, Dr. Dotson. I have a question about the procedures of taking or the schedule for taking these supplements. The milk thistle is my main concern, it being something to help your liver and your liver being a filter. Does this product or any of these products cancel each other out?
None of the products that I put together tonight to help manage diabetes cancel each other out. The milk thistle is to help, I guess, kind of the word we use is to clean your liver, right? It's to kind of maintain a healthy liver. So you want an optimally functioning liver in order to be able to metabolize all of the medicines that you take, right? All of the supplements that you take, all of the alcohol, food, drinks, whatever goes into your system, it goes through, it gets first passed through your liver.
Okay, so then something like milk thistle you should probably take later on in the day or later on in the evening.
Oh, I see. I understand what you're saying about the timing. No, you can take the milk thistle mostly from with most other medications, if that's what your concern is. You don't want to take it with the psyllium husk. The psyllium husk, I recommend you take, 2 hours before or 2 hours after you take any of the other medications. You don't want to take the milk thistle with like maybe grapefruit juice or something like that.
And also the psyllium husk, do you suggest taking it after you eat or before you eat, or does it matter?
So definitely I wouldn't take it after you eat. So I would recommend you take it before you eat or in between your meals. It can, because right, it really, it's fiber. So it's going to expand in your stomach. So you're going to feel full. It is, your body uses a lot of calories to try to break down fiber. That's why doctors are always telling you, eat fiber, because it just does so many good things. But one of the things it does is it takes a lot of caloric energy to break it down, because you've got lots of soluble fiber and insoluble fiber. By the time your body figures out, I can't break this down, this is just going to get, excreted out, it's already expended the energy to try to break it down. So you don't want to take it after, because you're just going to feel so full. You want to take it in between or before meals, because you want to feel full and eat less, right? So if you take it a half an hour before you're supposed to eat, what you're going to eat at that meal, because it causes satiety, you feel satiated, meaning full, you're not going to eat as much. That's also how it helps with weight loss as well. And also, I want to just say that the psyllium husk, I recommend the Atomy brand. I recommend doing it in a small, like 6 to 8 ounce cup of water. Mix it well and then drink it. Not because it retains the flavor and it's easy, and you can down it all at once. I can't drink 12, 16 ounces of water all at once. So, and you can't let it sit because it's fiber. It's going to congeal. So you can't just let it sit. So if you do it in about 6 to 8 ounces, you drink it, you feel, I feel like it's a treat. It tastes like drinking, blueberry juice, grape juice. So then you chase it with water. You do need to drink lots of water. So you drink the 12 to 16 ounces, after you're doing, but at least there's no rush, right? That you have to do it all at once. Okay.
Thank you.
All right, thank you very much. Next, we're going to Phyllis Johnson. Phyllis, unmute.
Good evening, everyone. Doctor, you pretty much answered my question, which is, with all the different supplements that we can take, which ones go best together in the mornings, afternoon, and the evenings, with food, without food? And can we have a chart or something? That's not diagnosing anything, but just healthy recommendations? I am kind of a rebel, and I did what your patient did, which is told the doctor, no, I want to try the hemoheme, give me a chance to see if this is as good as it was, told to me and recommended. And he was amazed. He said, whatever you're doing, continue to do it. So I love that it was introduced to me, and I'm glad to be in the company and on the products. I just need some clarity as to which ones go together best, which ones to take in the morning, noon, and afternoon, with food, without food, like that, because I tend to just pile them all up in my hand, swallow down, walk out the door with the bottle of water. And I know that's wrong, because you just said no grapefruit juice on this one, and I need a little more clarity. That's all. Thank you.
Okay, great question. So because we have so many products, let me just focus on the ones that I recommended today, right? So the hemoheme, you can take, I recommend taking it twice a day, right? But you can take it all at once. It's up to you. So that there's no timing for that, right? There is some individualization that needs to be done depending on what other medications, right, that you're on. But if we're just, talking in a vacuum and we're talking about these supplements, then, you can take, I would take the psyllium husk in the morning, right? So that I would kind of do it like for breakfast, so that I don't eat so much and I'll feel full until lunchtime, right? Now you can take, I make the pura tea, I put the entire packet in a liter of water, right? Because I think the liter mixes well and it makes it, I like my tea mild, and the pura tea in a liter of water, it's mild. If you like it stronger, then use less water. But I use that and then I take my other medications with it. You know, I'll take my milk thistle. I'll take my vitamin C, and I'll take my probiotics, right? Because I think it all tastes very good. So it's like candy to me. I use it. The other thing I would do is, you know, I drink my pour tea throughout the day, right? So I do a liter. Even I know it's a challenge. I do a liter in the morning, a liter, you know, in the afternoon, right? I don't, because pour tea can also have a diuretic effect. So you don't want to take it too late because it'll make you go, it'll make you pee. So, you know, time that so that you drink it all throughout the day. The what else did I? Yeah, the milk thistle you can take with the probiotics and with the protein, and I take it with the hemohem. I also take my omega-3 and I take my I-lutein all at the same time. Okay. The only thing I would tell you is don't take the psyllium husk at the same time that you're taking any other medicine or any of these medicines. So you heard me, right? So if I were to get up in the morning, you know, I'm having my pour tea, the hot cup, right? And I'm taking all my supplements, all my medications, right? So, and then in about an hour, 2 hours later, maybe around 9, 10 o'clock, I'm drinking my my psyllium husk. So by the time lunch comes around, I'm not famished. I'm full, and so I'm picking at my lunch, and I can afford to pick a healthy lunch, right? So that, because you don't want to, get to the point where you're famished and you're overeating, right? Most people, we eat in 10 minutes. What, we really should be eating over 30-minute period of time. I don't know if you've ever gotten a phone call in the middle of dinner, you walk away, you talk on the phone, you come back, you're not hungry anymore. That's because, the 15, 20 minutes, whatever the time that you've been gone, the signal from your stomach has gone to your brain that says, hey, I'm good down here. My stomach, it's full, I'm okay. Remember, your stomach should be like the size of your fist. It doesn't take a lot to fill that up. But, we're wolfing it down in 10 minutes, and then you've overeaten, you feel just awful, right? Because you feel too full. So just slow it down when you're eating. But that's how you can take the that supplements that I just recommended. Also, well, I didn't talk about this, but the Finezyme, you only want to take that with your meals, right? It's digestive enzyme. So if you're not eating, what are you digesting?
Okay, all right, thank you very much. Okay, we're going to take last 2 questions. Keep your questions short. We're almost out of time. We're going to go to Mary Lou. Mary Lou, unmute.
Good evening, everyone. I am Mary Lou Kabatingan from Raleigh Center. Good evening, Dr. Dotson. My question is, which supplement is best to recommend for a person who already taking insulin? Thank you.
So someone who's already taking insulin, I assume that we're talking about type 2 diabetics. So none of the things that I said would be prohibited. The idea is I would start with hemohem, right? And I would start with the psyllium husk. It depends, if I get 3 choices, I'm picking hemohem, psyllium husk, and then and the probiotics, right? But so if you can only do one product, then I would say the hemohem, because it has serious, antioxidant, anti-inflammatory properties, all of the things that diabetes has, right? That's why hemohem works so effectively for endocrine conditions, because a lot of these are considered autoimmune conditions. Your immune system is not operating normally or optimally, right? And so when you put that in balance, give your body the tools to fight it, it works well. So you may not get off of the insulin, but your insulin need will definitely reduce, right? So if you're taking 10 units of Lantus at night, I'm certain you're going to go down, right? Et cetera.
Yeah, Doc, how many I mean packet of the hemohim?
I would, it depends on where you're starting, but I would definitely, if you're really making an effort to come off of your medicines, we need to titrate down, right? So as you're taking the hemohim and it starts to work, you're gonna decrease your insulin. But definitely I would start with 4 packs a day, 2 in the morning, 2 in the evenings, right?
Thank you. Thank you, Doc. Thank you.
But you need to make sure you're monitoring it closely. So you can't check it every 3 months. You got to go closer in the beginning. Check your levels maybe in 1 month after you start taking it.
Okay, sure. Thank you.
Okay, the next we have a person, the name comes up, Zoom user. So whoever hand is up, go ahead and unmute and ask your question.
I think that would that be me, maybe?
Yes.
Is it possible? Okay. So the question is, so with all the supplement that Dr. Dotson had suggested for today, and how about if you were taking high blood pressure, blood thinner, and cholesterol, and so you take that 2 times a day, then when do you take these supplements? Is it in between time or is it 2 hours after each medication routine? Does that make sense?
Yeah. So you're asking if you're taking other medications, right?
Yeah.
When do you take this up? So as a general rule, because a lot of these you can take at the same time, but it depends. So as a general rule, to not have to think about which one, if you separate your medications with, I would say 2 hours, right? Because it usually takes about that long. Usually takes less, but people who are on these medications have other conditions that usually have are related to slower GI tract motility. So it takes a little longer. So if you do 2 hours, it's a good safe interval, 2 hours before or 2 hours after.
I see. Okay, thank you so much.
Okay, all right, I see Mon has raised his hands. He's one of our leaders, so we're gonna stretch it. Go ahead, Mon.
Thank you, Uncle Mike. Dr. Dotson, I just want to say thank you so much. Really appreciate that information, because we know a lot of people do need to hear this information here. So thank you, Dr. Dotson. Thank you, Uncle Mike. Back to you.
All right, thank you very much, Mon. Okay, we're gonna, once again, Dr. Dotson, we appreciate you so much. Let's give her a hand. And I'm gonna turn it back over to Sales Master Sharon Wilson, and she will give us closing words. Sharon?
All right, thank you so much. We do have, I'm thinking I saw her, and I do not want to overlook our leader here. She may be.
Yusuk Sung, Royal Master, she was online.
Okay. Well, we're grateful for her and for Sherry Lee.
She's still on.
She is? Okay.
Yes.
Yes, there she is. Yes, ma'am. I want you to just address us and we'll go home. Miss Yusung Song. Go ahead and unmute. There you go.
Hi, good evening. Wow, Dr. Dotson, thanks for sharing your knowledge. We are not a professional medical part, but that's why sometimes we have many questions how to introduce new people to daily supplement Atomy. Today you sharing a lot of knowledge. Thank you for sharing. I know you're so busy people. Another time, please come again. Thank you very much. I love you.
Awesome. Thank you so much. Thank you so much. I posted in the chat, if you could copy that link. Dr. Chung talks about how you take your supplements, and it's pretty much in line with Dr. Dotson said tonight. So for y'all that need to kind of get that in your mind, how to take your supplements, then just click on that and go to that YouTube page and listen to Dr. Chung. He really breaks it down. So we're getting ready to go. Sherry Lee, are there any announcements?
Oh, hello. Hi, Sharon. Hello,
Hey.
everyone.
Hello.
I just want to remind everyone we have a promotion going on for the free gift. So if you haven't checked your website, don't forget to check the Atomy basket, and then you get a free mask. So that's the little reminder for everyone. Thank you, Sharon.
All right, thank you. Thank
Dr.
you.
Dotson, thank you.
Yes. So I have a quick question for Dr. Dotson. Are you licensed in Mississippi?
I am not, but I'll look into it.
Okay, please do. Please do. We certainly appreciate you once again. And so at this time, thank you all of our guests for being on. We're here every Tuesday night just sharing great information and great testimonies. And we're just glad to have each and every one of you who are guests tonight. Thank you again. And at this time, Uncle Mike, you want to go ahead and take us home with
All right. All right. Thank you very much, Sales Master Sharon Wilson. And again, thank you again, Dr. Suzanne Dotson. All right, everybody unmute. We're going to close out with the company motto. All right, with that being said, one question, company motto. Are you ready?
Ready.
Oh, all right.
Thank you.
Great call tonight.
Thank you, Dr.
Want to thank
Dotson.
everyone for coming together. I think the most I saw there was 69.
Yeah.
Thank you, Dr. Dotson.
Thank
you, Dr. Dotson.
Good night, guys.
Thank you, Dr. Dotson.
Yes.
Thank you, Dr. Dotson.
you,
Hope we
good
will
night.
hear you
55
soon
strong.
again.
Sheila Mack, I want you back.
Thank you, everyone.